Hey y'all, this is Dr. Kelly Clark over here at Patient PT in Bloomington, Indiana, and I recently got a fantastic question from one of my members that inspired me to create a new video series for you that I am going to call the Top 5 Most Prescribed. So the person in question is somebody who's been coming here to Patient PT for a little while. They've already graduated from a physical therapy plan of care and moved on to nothing but wellness care. So they just come in, ask questions. Sometimes they just get massages. It's a pretty good deal. And this month, when they showed up, they wanted to ask me a question that had just sort of been occurring to them occasionally in their spare time, which is, what are the top 5 exercises that physical therapists most frequently prescribe? So, of course, there can be a lot to that question, and I at first was a little bit stumped, but after I thought about it for just a few seconds, I realized that it's actually pretty easy to narrow it down to at least a category of exercises that affect pretty large regions of the body all at once. And so I was able to give them a list of exercises, and since then I've continued to think about it, decided to make a little video series talking about each of those exercises and why it is that I prescribe them so frequently. So I'm going to go ahead and share my screen so that I can give you guys a little bit more information about what exactly I mean by all this. So get my Zoom window out of the way. So here is an image of the bottom of the foot, okay? So spoiler alert, the exercise that I'm about to describe is called a short foot, okay? Basically, a short foot is when you place your foot on the ground and you try to, as much as you can, arch the center of it up willfully, okay? So the reason that that exercise is so important is because it starts to activate several different muscles in the sole of the foot that are really important for maintaining your arch. One of the big ones is this abductor hallucis longus. Actually, I believe that's brevis, that is shown over here on the right side of this diagram. It also can activate flexor digitorum brevis, flexor hallucis, and a couple of other of what are called intrinsic foot muscles. Intrinsic means inside. And so intrinsic foot muscles are muscles that are inside the foot. And most of the muscles that actually maintain the height of your arch are located inside the foot. So that is why short foots are one of the exercises that I prescribe so frequently. Now, the reason I started with abductor hallucis is because abductor hallucis is one of the most important muscles for maintaining the distance between your big toe and your second toe, okay? So some of you may be aware and may even have as a part of your life a condition that most people call a bunion, okay? So this foot diagram that I have up on the screen right now actually has a little bit of what I would call a bunion. You see that there's kind of an extreme angle over here at the base of the big toe, all right? And the reason for that is because oftentimes, a lot of times related to shoe wearing, people will have this particular muscle called abductor hallucis, which all that means is move out to the side and big toe, okay? Abductor means move out to the side, hallucis means big toe. So abductor hallucis moves this big toe out to the side. And when that muscle gets weak, the toe starts to drift more and more inward so that it has more the appearance of this toe on this particular diagram. And some of you may have even seen feet, or maybe on your own feet, where that big toe actually starts to drift over and lay on top of the second toe or the third toe even. So that can cause some problems and discomfort inside your footwear just because your toe is kind of pointing into the wrong area. But it also makes your arch feel quite a bit weaker. And it doesn't just feel quite a bit weaker, it actually physically is quite a bit weaker. And there have been a lot of studies in the physical therapy world that show how strengthening these intrinsic foot muscles can have a big impact on ankle pain, foot pain. Sometimes it even goes all the way up into the knee and hip because of the way that the musculoskeletal system works together. Each part has an effect on other parts and what's called a tensegrity system. I'll probably end up doing an educational video on tensegrity one of these days. But another exercise that comes up quite a bit that is a good alternate for short foots for some patients is actually called a toe spread. And that's exactly what it sounds like. You just try to willfully spread your toes as far apart as you possibly can, and then relax them. And spread again, okay? And so for some people, that's really kind of an aspirational exercise. This diagram that I have up here on the screen shows a toe spread, but most people can't actually get their toe past the line of this outside or inside border of their foot. And that's pretty normal. But if you continue to practice toe spreads and short foots and intrinsic foot strengthening exercises like that, both your arch and the drift of your big toe will start to change over time. I tell patients a lot of times that foot exercises are what I refer to as a labor of love, because at first it doesn't seem like it's doing anything and it may seem quite hard. You may not even be able to easily move that joint of your foot, but eventually it does start to stack up and make a bigger difference. Here is just another paper that was talking about short foots versus toe spreads. I find that this is the question of exactly which exercise a person needs is really variable from person to person. And that's why you need somebody like me to give you a hand and try to figure out exactly what thing you need to address your particular weaknesses. And here I loaded a few examples of these different types of exercise. So the reason that I loaded this first one that is appearing up on the screen is actually as an example of what not to do, okay? This is actually the only one that's currently in this exercise program listed as a short foot, but that is not the way that I do short foots in my office. I'm going to see if I can find a view that makes that image just a little bit bigger here. Okay, so that's the arrow I wanted. So as you can see, this person actually has their big toe pointed straight up in the air as they're doing this short foot. And in the second image, this already pretty high arch here is even much higher. So you may have enough strength in your foot and control over your foot to get this kind of range of motion, but actually having your toe sitting straight up like that is not good for you, okay? That actually can have a damaging effect on the overall shock absorption ability of your foot, depending on what you're doing with it. Some people run, some people don't run. And if you are among the folks who are running or trying to run in particular, having too rigid of extension in your big toe can be a big problem, okay? And really make it harder to land softly on your foot. That can lead to things like stress fractures. So what I recommend more frequently is a short foot that looks a bit more like this one. This is actually the picture I end up using for a lot of people. So this is not quite as extreme of a demonstration. It's probably part of the reason that it is a little further down in the list of exercises on my program. But you can see in this top picture, the person has a relatively flat arch. That's actually a fairly typical arch that I see in an average, not super athletic sort of person. And then here in the bottom image, they have that arch flexed upward just a little bit, and they still have their toes flat on the ground. That's really more what you want to do if you're doing a short foot exercise, okay? And that's because it mimics the best foot position to give you a nice wide base of support when you're in standing, and prepares you for that push off at the very end of your walking stride, all right? So another variation that's in here is a person who's doing a short foot while they're in a standing position. That would be considered a little bit of a progression of a short foot exercise. And there are actually some folks who will even prescribe walking short foot exercises. Some people call them sea walk, but essentially the idea there is to try to maintain deliberately that high arch even the whole time that you are walking around. And that is really quite hard to do, and not something that I really recommend folks do very often, because in my experience, it's just a little bit too hard to manage. It's kind of a lot of thinking to do about a motion that's really supposed to be done quite naturally. And so that's why I wanted to switch back to the camera here, and I'm going to turn my monitor and camera around to face my big whiteboard so that I can draw a little diagram and explain exactly how it is that foot motion ideally works to give you maximum shock absorption. All right, so I've got this monitor on a lazy Susan. Let's see if it'll stay for me and get focused. Okay, so here we are, and I'm gonna move my friend Herman out of the way. He's actually much smaller than he looks there. Just kind of taking my camera into the wrong level of focus. All right, so now with Herman out of the way, I'm going to draw you guys a diagram. So a lot of people ask questions about how feet are supposed to land when they're walking and when they're running. And there's a lot of confusion about that because actually it's a complicated answer and it changes depending on whether you're talking about walking or running, okay? So here is kind of an outline of the bottom of a human foot, okay? And I'll just erase this little bit of text up here so that I can add in some toes. So looking at this outline of a human foot, I want you to think about little footprints, okay? So here are toes. And ideally, a human foot print, whether it's in sand or on a paper bag, as some folks will do just to get an idea of how a foot is landing, is to have the ball of the foot, the heel of the foot, and the side of the foot showing as part of that footprint. And the reason for that is because when your foot is landing on the ground during a walking stride, ideally it is going to hit back here at kind of the outside of your heel first, okay? So the bone at the back of your heel is called the calcaneus. And the calcaneus is basically like a big rock of a bone. It's a nice, heavy, round bone that's very strong, and it's padded with a little bit of fat around the side so that it can absorb shock. But really the shock absorbing action of the foot is in the roll, okay? So you may have heard before that you're supposed to walk from heel to toe. And what that really means is you land back here somewhere on your heel, and that is variable depending on the shape of your hip, your foot, your strength, but somewhere on the back of your heel, and ideally a little bit more to the outside of your heel, is where you land. And then as you progress through the stride, okay, so as you hit heel first, and then your foot is rolling through in that heel to toe pattern that everybody talks about, what you're actually doing is rolling along this outside of your foot where you have calluses that appear, okay, that's also where the shock absorption occurs. There's a bunch of different bones back here above your heel that absorb some of the shock that travels up into your leg. And then as you roll onto this outside of your foot, you get onto some more of the tarsal bones and then out to the metatarsals, which are these long bones that extend up towards your toes. And then at the end of the movement, you land kind of on the outside of the heel and roll over onto the ball of your big toe with a final push off up here off of your big toe, okay? So that is what people mean when they talk about walking heel to toe. Now, one place where a lot of people get confused is when they are trying to increase their training and maybe they are switching to a running or a jogging stride. So the main difference between a running stride and a jogging stride is during a walking stride, a person usually has their knee in what's called an extended position, which means a straight position. In a running position, when the leg hits the ground, it's in more of a flexed position with the knee bent like this, okay? So I've got his heel bent, or his heel bent kind of deceptively here. If Herman was actually running, ideally his leg would be more in this position, okay? So that means that you have more of what's called a forefoot strike. The forefoot is the front of the foot. It's like the ball of your foot and your toes, all right? So ideally for running, that's where you're going to be hitting first. And it's kind of an abbreviated version of an ideal walking stride. Grab my markers here. So this green arrow is showing the ideal pattern of a walking stride. For a running stride, it's a little bit different, okay? So I'm going to switch to my purple marker here. With a running stride, you skip this back half of the foot, okay? Because your foot is not really on the ground very long at all. You really just hit kind of up here at the forefoot, and ideally, it roughly starts here at step 2 of your walking stride, okay? So slightly on the outside of the ball of your foot, then traveling over towards the toe and pushing off from the toe, just like with a walking stride. But for a lot of people, this means that they have to shorten their walking stride up a little bit. They have to, shorten up their running stride a little bit more than they expect to, so they feel like they're taking kind of shorter steps. That does absorb quite a bit of the shock when you're running, and a lot of times it encourages some of the muscles in the upper part of your leg, upper part of your lower leg, like out here on the side of the leg where the fibula is. There is a muscle, there's a group of muscles called the fibularis group that have a lot of control over ankle strength. And so in the next episode of the top 5 most prescribed at Patient PT, we'll be talking a little bit more about ankle strength. But that's my tutorial for today. I hope you enjoyed it.